Nighttime stories were all about what the doctor did, how the patient responded, and what were the outcomes. The patients were so happy. I would hear those stories and I would have goosebumps, and I would think, what could I do to become one of those heroes? And that was one of those impact that I would say left on me to join the healthcare industry. COVID hit. Most of my patients started to come back over and over again. Whatever I could do, but they were not happy. And then I found out the holistic care is possible only if I connect physical with mental health. Instead of going to the pharmacy to pick the medications, go to a grocery store, green leafy vegetables. Anything that comes from the ground or that grows on the trees should be your best bet. If you tell them, they see the difference. This is what I preach to my patients. If you want to be healthy, or if you want to be successful, or if you want to be contented, please do not ever compromise for your health and your happiness. Do whatever it takes at any cost.
Hello and welcome, and Dr. Vishnu Upadhyay. So, first of all, welcome to the show. Welcome to Top Health Media Network. And before we start our conversation, why don't you give a brief introduction to our listeners? Very brief. And let's start there first.
Thank you. My name is Vishnu Maya Upadhyay. I'm triple certified nurse practitioner. I specialize in women's health, mental health, and behavioral health. I've been in health industry for more than 20 plus years, and my passion is to provide preventive care so we can detect the diseases in early stages and promote the health in the community. I am a mother of 3 kids, 2 daughters and a son, and I have a very loving, supportive husband, and we live in Dallas, Texas. And it's my honor to be participating with you in this podcast. Thank you.
Thanks for this introduction. So, before we go into your professional experiences, let's go back, all the way back. Where were you born and raised? Was either of your parents a doctor?
I am born and brought up in New Delhi, India. And my dad was in British Army. He doesn't have any medical background, but my mom was a midwife working for a hospital growing up as a child. I was very much influenced by her. She going to work, coming back home with some stories to tell at nighttime. Nighttime stories were all about what the doctor did, how the patient responded, and what were the outcomes. So my once upon a time stories were, once there was a patient, the doctor had done this, very happy, good results. So that's how I got influenced.
So,
And then my older sister went into medical field as well, and she was the one who inspired me to get into healthcare.
I was going to ask, so I'm guessing that your journey in healthcare really began from there, right? It's just the influence of your mother and your sister. And how many siblings were you? You and
We are 4 brothers and one older sister, so total 6.
total 6. Wow, good. And what was the defining moment in your, I guess, in education where you made the decision that, you know what, I'm going to be a doctor?
I wanted to add on, I'm not a medical doctor, I'm a nurse practitioner. So I have a nursing background, and I just did some advanced education to add on to doctorate in nursing practice. The breaking point started from looking at my mom, and then my sister went into OR. She was an OR operation room nurse, and I would hear story from her as well. The only thing that I remember that impacted me most, the outcomes. The patients were so happy. I would hear those story and I would have goosebumps, and I would think, what could I do to become one of those heroes? And that was one of those impact that I would say left on me to join the healthcare industry.
And your nursing education was in India, or you came to US?
I did my Bachelor of Science and nursing from India. After I graduated, a team from Bahrain came to get some professionals. So they contacted our college dean, got the numbers. We were called for interview. And I think there were about 10 or 12 friends from the same college went to Bahrain. And I worked there for almost 3.5 years. I really enjoyed working in a cardiac center. But again, there was always a tug in my collar, pushing and letting me know there is something better and bigger for you. I was very happy. I took care of people who had cardiac surgeries before the surgery, after the surgery, or who had stent put in. Very nice experience. I was provided a very nice villa. Every 6 months, I was allowed to go home with free ticket, all that I could carry with me from there. But again, the quest to do more, to learn more, and see more led me to USA.
Wow. And and now you are triple certified, right, in family, women's health, and mental health. So this is itself is very unique because people get board certified in one or two things. You're in three things, so that's rare and powerful. But what inspired you to go again deeper and wide, I would say, across specialties, rather than staying just in, just family, or, just family, or one lane itself? What made you do, like, I got to cover all three things?
I did not want to cover all three things. I don't know how it happened, but I know for sure growing up as a child, it was just drilled in. Education is the key to all the success you can have in your life. You can lose your car, your bank balance, your house, your health, but you cannot lose your education. You can start from scratch and build an empire, and you would be respected right next to standing with the president or CEO of the company if you have good education. I came in as a nurse, did nursing for 2, 3 years. To know more, I went into nurse practitioner at UT Southwestern and I did my women's health. Loved it, worked as a women's health nurse practitioner for 9 years in a very big hospital here at Parkland. But again, when you learn something and you do it over and over again for 9 years, it gets to be like stagnated, and always there was a desire. The country is full of opportunities. You look around, you see young people doing amazing things. You hear research coming up with new things that you could impact the people. Why should not I broaden my horizon in the education? After doing my women's health for 9 years, I approached my workplace to see if I qualify for more education. And back then they had a ladder program. If you had worked and done well, they pay for your education. I grabbed the opportunity. I went into family nurse practitioner, fully paid. I didn't have to pay a penny for the program, but I was working for Parkland Hospital. I'm so grateful that they gave me this opportunity. While I was a student in Texas Women University, I was picked again for student awards. And then instead of paying the school, I was given money back for my books and stationaries and all that. So that was another help. And after I became a family nurse practitioner, COVID hit. I was working as a family nurse practitioner, women's health nurse practitioner. Most of my patients started to come back over and over again. I checked them top to bottom, did their lab, whatever I could do, but they were not happy. They would keep coming back with one or another problem. And then I found out the holistic care is possible only if I connect physical with mental health. At that time, I was doing my functional medicine to heal the body with the environment, with the food, not with the medication. I stopped that and I went back to get my postdoctorate in mental health so I could understand the mental health of my patients during the time of COVID-19. And it became a big blessing. It was very good for the patients. It was very good for me because my patients were not coming every other weeks for me. They were happy. And it also became a blessing for the practice because now I was able to take care of women, men, children, and their mental health. So having those certifications gave me skill sets to take care of my patients in any field they were in. I didn't have to pick and say, okay, you have women's issue, please go somewhere else. You have a men issue, I cannot take care of that, go somewhere else. Now you have mental health issues, go somewhere else. So I will see them, screen them, find the problems, and take care of them to the best of my knowledge and my abilities. And when I was not able to, I was able to seamlessly transfer their care to the psychiatrist, endocrinologist, cardiologist, internal medicine. So having an extra education under my belt made me more confident, and I had satisfaction and smile from chin to chin that I was able to take care of patients when they came to the practice.
Very nice. I have to step back and ask you one more question about education here because education is evolving, and the general view across the country is it's probably diminishing in its quality or in its relevance, right? And so, what's your take on that? Because clearly, you valued and you quite seriously valued to the level that, and that's why you did what you did. But now, given considering for your children and the future generation, there is this notion that maybe the education will change and you probably won't need colleges, but something else will happen, and there are new kind of trades coming up, right? Like there is a lot of digital jobs are coming up. There is YouTube influencer is a job now, right? So what's your take on that? Do you personally think the value of education or its relevance is changing and it's on the lower end than where it used to be?
I'm surrounded by students because I precept nursing students, medical students, physician assistant, registered nurses. And I always tell them it's all in your hand and in your mind to learn as much as you want. Nobody can stop you. When you go out to the schools, to the colleges for your clinicals with your preceptors, they're going to give you whatever the best way they can. And there will be some time when the surroundings are not conducive or environment is not favorable for them to sit down and hold your finger and teach you step by step, PowerPoint by PowerPoint. But if you are a diligent, hardworking, and curious student, you would somehow find ways to learn what you wanted to. So it's in the keys in the hand of a student. I don't think the quality of the education is going down. Maybe there is a lot of social media out there that's saying there is so much out there. You pick what you think is best for you, and you already have basics and you just need advanced. I have seen students revolve 365 degree just being on their own. If you have the desire, and of course you need some help. So regardless of what's going around, the AI or whatever the rumor going around, I still think if you are a lifetime student, you could evolve on your own and get the best result that suits you. And if you don't get it, you go somewhere else and somewhere else, find somewhere else. There would be somebody who would give you, or someplace you would find that would satisfy you and you would be happy with the results. So I quite don't agree with that. I think it's in your hand to achieve what you want to.
Okay. And now back to your practice. So you've been practicing since 2000, and then you opened your clinic in 2015, right? So which is, so what was the original spark for you to open that, now I have to open my own clinic? And was there a gap in the market that you saw at that time? Like, you know what, I'm going to fill this gap, and that's how I will launch my clinic. What was your thought process?
I did not want to open a practice. I just want to go do Monday through Friday job, Saturday, Sunday off, take care of my kids, be a good mom, a good wife. I finished my school. My last preceptor left a huge impact on me. I saw him the way he treated the patients, went above and beyond, spending quality time to the point that the staff had to get alarm clock for his door saying you are more than a 45 minutes for a 15 minutes visit. Patient would come in, he would treat them. They don't have money to buy the medication. He would refund the office money and tell them to go buy the medications. Every single patient that I would see before he went in would say, "Oh, we came to see him, not you." And when I would ask, "What was that unique?" And most of them said, "He saved my life." The same doctor, after I precepted with him 2, 3 rotations, offered me the keys of one of the clinics to run it for him. Maybe because he saw that we had a good match and we could, know each other's flavor and take care of the patients. I had to put it down. I said, "No, I will work with you, but not alone." But he kept insisting that I see that you have caliber, you have potentials, you will be okay. But I didn't take the job. I went back, worked in hospitals, took jobs in outside clinic, worked for my friend doctors, but somehow I just didn't find the satisfaction in providing the care that I wanted to do it in my way. My way was good quality, safe care, not the volume based, but the value based, where I sit down, talk to them, connect with them, spend some time with them. And then in the end, they leave with a smile on their face and I leave with like satisfaction. I've done my job. I was not able to get that. The other practices or the other hospitals, they have to meet certain numbers. They have to have certain reimbursement, overhead, budget. But then I thought if I would open my own practice, I don't have to worry about anybody watching how efficient, how productive, whether I was going to be thriving, paying the overhead or not. If I want, I will shut it down. But at least I would have peace that I delivered the care that I wanted to do in my way. It was January after New Year. Me and my husband were sitting outside on the porch, and he is a good listener. Anytime I had any problem, I would go tell him, and he would listen. And then he offered, I've been listening, everywhere you go, you feel like you could have done this way, but you ended up doing this. Why don't you open your own practice so you could do what you want and bring the best? Since you have artistic look, you could bring out and feel happy. He's a CPA by profession. And I said, okay, I give you the job then. Open a practice. He opened the practice for me and I designed the clinic layout, the fixtures, the color, the paintings. And 1 year later, we went live.
Wow. And so your husband is also engaged in a practice with you, or he was just making sure it's open and running for you, and then he went back to his business? Where is he involved?
It's not only my husband, my whole family. I have 3 kids.
Yeah.
They all are involved in it because, one person is at the clinic coming home late, weekends going over chart reviews and meetings and all that. Then somebody would have to come pick them up from the dance class, from the piano, take them to soccer. Kid had to sacrifice with understanding, and dad had to take over. Not only that, he also helped out as a CPA in the practice, keeping a good tab on the numbers, letting me know if I'm going up, I'm going down. There was a time when I didn't make any money for 6 to 7 months. And he, as a CPA, assured me, if I don't blow a whistle, you're fine. So just keep doing what you're doing, pursue your dream. If you hear me blow the whistle, then we sit down and have a meeting. 9 months passed by and he never blew a whistle. I went and I looked at my record and they were not looking good. So I asked him, what's going on? And then we found out that there were some billing issue that didn't get done, didn't get filed, denials, decline. And he didn't want to alarm me because he didn't want to stop me pursuing my dreams. So he kept filling in those gaps by putting the money from his pocket. And then I had to change the paradigm and look into the angle of not only providing the care, but also knowing how to sustain it.
Yeah, I like to say that a lot of time I speak with a lot of providers who are building clinic or running clinic or trying to think of building one, right? And they all run into this situation, right? They're like, oh, I want to do this, but there's I don't know everything about it business wise, and it just there's so many things. And then once you take insurance, it's almost like there is certainty, but there is also uncertainty because you don't know. It's a vicious cycle how it works, right? The denials and claims and everything. So it's not that easy, right? It's like one of those things you need as many helping hands as you can get, right? That's what it is. And so it feels like your husband did a great job in providing you with that helping hand right on next to you, and making sure on his hand all those things are moving along while keeping you and not distracting you from the actual thing that you want to do, which is caring for the patients. So kudos to him, first of all. We should really acknowledge him for supporting him, like almost like your back office in that way.
There was a time when staff won't show up, or there's a flood, or there's a rain, or there's a storm. You're at the practice, but the team is not there. So he would cover the front. My two daughters are medical assistant. They're going into pre-med program. They would become my MA. They're certified MA. One would triage, one would room the patient. So the whole family was at the practice.
Wow. Yeah, that is really a family-owned business in true sense. That is so nice to hear. Okay, and now, of course, you emphasized, or I mean, at least that's what you did. You did this triple certifications, and I know that functional medicine is also evolving over the years, and not only its name has changed many times. Somebody calls it integrative, somebody call it functional medicine. It's always evolving, right? But one interesting thing I'm seeing now, at least now, and I want to check how you feel about this, is a few years ago it was more about like, oh, let's make sure we are taking this tab and we see like not just medicine, we also see nutrition, supplements, and those things come together, right? And that was the notion. Now there is more providers who are also saying, well, okay, let's make sure we also look at mental wellness along with this, right? So that's like one more layer to make it really holistic, right? So it's now nutrition, supplements, even mental wellness, medicine, and even sleep to that level, right? That's how the full, as I'm speaking with a lot of integrative medicine physicians, and a few of them are even more focused towards brain health now, even next level, because they were like, well, this circle completes, and now we're going to live more. So how do we keep the brain health better for living longer? So what's your take? Are you seeing this is generally how functional medicine is evolving? More providers are going into providing this whole coverage along all these things, or is it still early and still it is more focused towards nutrition and supplement side, and then other things are coming up? Where exactly it starts? What's the inside look from a doctor's or provider's world?
I think nowadays they have added nutrition classes into medical program. I've also had pre-med students come to shadow me to see if it is a field they should go in. And when they get into the program, they will call back and think that they got into the program. And I would ask, how about? Because of the interest in nutrition, the interest in exercise, and the stories that they wrote about their parents becoming diabetic and how healthy lifestyle made them non-diabetic. So it's catching on. And there are some practices who might not be implementing integrative, but they're losing patients. In my opinion, when a patient comes in, if you provide them care with holistic, in a holistic model, they really like that. My approach is always be very slow in prescribing the medications, but very fast and rapid prescribing lifestyle modifications, yoga, meditation, going for a walk, instead of going to the pharmacy to pick the medications, go to go to grocery store, green leafy vegetables, anything that comes from the ground or that grows on the trees, it should be your best bet. If you tell them, they see the difference. Wow, nobody mentioned this before, and we are seeing you first time, and you have opened up and peel the onion in such a beautiful way that now we see that there could be a change in our life. And sure enough, people do change if they put in one change, lifestyle modification, implement that in their life. So all I could say, the industry is catching on. I teach all my students that lifestyle modification should be their number one goal to go to. And integrative medicine is going to be the passion of the coming era, or should be. That's what I think. And this is who I would go to versus, traditional old ways of, take this and come see me. Your one hand is on the door, one foot is inside the room, and incomplete care. It does not satisfy anyone.
And in your practice, you are primarily insurance practice, or do you also have membership model?
We do not have membership model, but we do have self-pay. We do Medicaid, Medicare, commercial, but we do not have a model because when we tried, it didn't work. It was too much to catch on with the membership and all that, and it would require an entire team, and I didn't want to involve more people because to me, if I have to provide unique, quality, safe care, it should be individualized. I don't have to involve so many strings in it. So I didn't put the membership and other kind of programs to the practice. It's just simple. Self-pay, you pay me now or you pay me in installment, or you pay me later. If the situation is serious and I have to take care of them and they can't make it, I would just tell them, come see me. And whenever you feel like you can pay me, that's fine, but let me take care of you now. That's what I learned from my mentor, my supervising medical doctor. Target the patient and money will come. That's what he said when I was a student.
Yeah, very powerful. And are you also including things like weight management and GLPs in your practice already, or that's something you don't touch yet?
Being a nurse practitioner, I have a scope of practice and a supervising medical doctor that I have terms and conditions signed with. I do not do those, but I know with lifestyle modifications, I have achieved tremendous, excellent results that I didn't have to send them to the pharmacy to get those weight management medications. There were situations when patients were really uncontrolled diabetic, uh, uncontrolled hypertension, morbidly obese. Lifestyle modification would take some time, and I didn't want them to suffer the consequences, the complications. I would refer them to endocrinologists to take care of that. But in my practice, I do not prescribe those weight loss medications.
Got it. Now, more of a question, like business question, really. As a woman leading a practice and employing other nurse practitioners, what you believe, or what do you believe makes the nurse practitioner-led model uniquely suited for our healthcare system?
Nurse practitioners, it's a very tricky question. I should say that. I love the profession. I'm a nurse practitioner, so whatever I'm going to say is going to promote me and my profession. I take time with my patients. I target the patients, not the money. I go extra mile to make sure that they're taken care of. I teach my students that be the patient's advocate. Whatever they need, please listen to them. 90% of time, what's going on in their system would come out of their mouth. So pay attention to that. But at the same time, I have a supervising medical director that I really admire, because in a nurse practitioner model, we have scope. And anytime when patients come in and they're outside the scope of practice, I tab on him and I ask, I have this patient, how do I handle? So with his help, I'm able to provide care. And if it is still out of practice and he does not think that I should keep them in my practice, I refer them out to internal medicine or to the other specialty. So I would say nurse practitioner model is very easy, reachable. They take time. They know what they're doing because that's what we trained. And I have also mentioned it to my nurse practitioners that nurse practitioners are made to take care of the patients so they don't end up with breast cancer, prostate cancer, cervical cancer. So we have to promote preventive visits. I don't think I'm trained to take care of complex issues, uncontrolled diabetes, uncontrolled hypertension, cancers. Those patients, our job is to detect and send them to a specialist who could take care of them as soon as possible. So nurse practitioners are not meant to take care of complex cases requiring expertise of the specialist, but we as an extension can find and screen, detect them in early stages so we could expedite their care so they could have the best outcome. So I really admire this model. I think it gave me the desire to do what I want to, take care of children, assess them, screen them, prescribe them, follow up with them. And if I don't feel them, it's not only children, whole spectrum. If I don't see them that they're getting to the best of their health, I refer them out. And I always involve my supervising MD if I have any complex. And there's a requirement that supervising MD reviews our chart to see if there's any deficiency. If there's any deficiency, we have meeting, we correct it, we make it better. So I love the model that it gave us the freedom to do more, faster, and in an efficient way for the patients so they don't have to wait for MDs or DOs who are busy taking care of complex cases.
I like that how you explain it. It gives a very clear thought process to, you know, for anybody who's listening too, because a lot of time people just like get confused because they're like, it's like a doctor, or you know, then there's like provider, and then they get confused, right? So it's very important to explain, and so I really like your explanation how you did it here. So obviously, you know, you've worn multiple hats, you know, being a caregiver, leader, mother, and you know, you're also doing a lot of community work. So, but beyond the titles, beyond this work, what does success look like to you? At least at this stage of your journey, what it means to you for now?
I've seen a lot in my life. I have gone through lots of ups and downs. To me, the two most important things that if I would achieve, if I have, I would be very happy and call myself a very successful person. I don't think success is defined by the kind of car I drive or the amount of money I have in the bank or the kind of house I live in. To me, the success is defined by two most important factors, which is number one, health, very important. Number two is happiness. If I'm healthy, I'm happy. If I'm happy, I'm healthy. So these are two pillars of my life, and I know one cannot live without the other. There were some times when I got very sick taking care of what I have created. I took care of everybody else except myself. Took me a while to realize I had to shut down everything, take off, go to mountains, and think what went wrong and how could I fix it. So I remember that health and happiness, very important aspect of my life. And I think This is what I preach to my patients. If you want to be healthy, or if you want to be successful, or if you want to be contented, satisfied, please do not ever compromise for your health and your happiness. Do whatever it takes, chase it at any cost.
What is what has been the proudest moment as as a professional healer? That's what you are. And what's been the hardest? Can you talk about that?
I have started practice. Mom walks in. She wants her 10-year-old son to be cleared for sports. It's Friday. I did the exam. I felt the murmur. It didn't feel good for me to tell her here, because usually sports physical don't take more than 30 minutes. I listened to the heart and I felt there was something unusual, abnormal. Took the blood pressure, standing, sitting, checked the blood pressure, top, bottom, didn't match. So I mentioned to mom, I'm not going to sign. She got very upset. And then she mentioned, my 10-year-old son already has a primary doctor, a pediatrician that I'm seeing, but he cannot get her in. Can you just not clear him? And I said, nope, I'm sorry. I paid you. I said, I'm sorry, I cannot clear up, take the money and find somebody else. But I think he should be seen by a pediatric specialist, a heart doctor. She said she doesn't have time. And I said, it's Friday. He needs to join on Monday. I don't have time. I said, I can give you a note that says that it's pending. Her argument was he got excited, nervous. That's why I was hearing what I was hearing. So she wanted him to go home and rest and relax and come on Monday. I said, okay, we could do that. I brought him in Monday morning and he was feeling the same. And I said, sorry, I still cannot release him. She got very upset. I said, if you want, I can call the ER and transfer. She said she doesn't have time for all that. So I called a pediatric cardiologist saying, I really don't bother you, but this is a situation where mom is really upset visibly in the lobby, in the exam room, to the point that the other people could notice. Can you please take care of her for me? He said, send her in. So he squeezed her into the schedule. Next day, I always do a follow-up call on my patient next day to see everything was fine, if they had any concerns or questions, if there was any issue getting the medication, so I could take care of that so they could get what they were prescribed. I'll call next day, she won't answer. But this was a special case, so I called her for almost a week and I did not hear from her. So I thought, okay, what happened? Let me call the cardiologist. So I called the cardiologist, come to find out he had tautology of phallic, a very big, coarctation of aorta, where the heart vessels were not functioning well. And he had to undergo a surgery. And this is not the surgery one time. He's evolving as a 10-year-old. So they would have to do multiple. So as he grows, the heart system grows with it. And this is what I heard from the doctor. You really caught a very good case. You pretty much saved his life. So that was a very big aha moment that I had to take all the frustration from mom, but I did not let it go. I went above and beyond. And the 10-year-old would be now, it's almost 13 years, must be a 23-year-old boy. The mom came back maybe like 3 months later. I saw her in the parking lot and I thought, this is a very complex case coming after the heart surgery, and nurse practitioner scope does not allow, to continue the care with somebody who has to undergo several procedures. But she came and approached the window stating, thank you for not giving up on me and my son, even though I was rude and tough. Can you also check his brother to see if he has something? While I was doing that, the boy made a video of the clinic, the lobby with my picture on it, and he played it on Red Cross, the doctor who detected it and the doctor who saved. He videotaped the doctor who did the surgery and how he became what he is today. So very impressive. And mom put in another review. on the Google. There are several other cases that I had detected being a very diligent provider, taking time with them. Somebody comes in for physical exam. So, a daughter, 16-year-old, comes in with chest pain. First time, go ahead and undress, checked. Her spine was crooked. For 16 years, she had a crooked spine that crushed her internal organs, that she was having hard time breathing and chest pain. I sent her to Scottish Rite. She got rods and screw placed in, and she became one of the cheerleaders.
Hmm.
Mom thanked. So, and I think it was because the way we, the way I examined my patient. Another patient came in, doc, just fill my medication. What's going on? I have high blood pressure. My regular doctor is busy. I cannot get in. I just want you to fill in my medicine. Pressure is 220 or 110. Sorry, I can't. Nurse practitioner scope says triple digit. We need to do some lab. We need to find out what's going on. But this is a very high digit. You have to go to ER and you're out of medication for 1 week. He didn't want to go. He had come in with his sister and she defended him. And I would say, here, this is your money. I'm not going to write you the medication because I think you will need more help. This medication might not control your blood pressure. Convinced them. He agreed to go to hospital. I used to work for Parkland, so I called Parkland back ER line saying this patient is very much in a need to be seen, but he does not have patients to wait in the lobby. Could you expedite him? So he went in, got in. 2-3 days later, I called. He got admitted. He had a kidney failure. Had he taken all the medications just because he paid $100 or $75, we would not have found out. His sister-in-law brought her husband, who is his brother, to see he was okay. So I'm proud of what I've done, and I think I would continue to do that model where I'm spending quality time with my patients.
All right.
You asked one story, I gave you three, and I have several others, but
I bet. Yeah. Um, so this has been great. I really appreciate you sharing everything. But before we end today's conversation, we do more like a quick fire round, just for real quick 3 questions. So I'll start with those now. Okay. What's your favorite way to reset after a long week, or let's say, of caregiving and your clinic? How do you reset?
I love doing meditation. I have done 10 days retreat. I would shut the door, close my eyes, and go for meditation for an hour and a half to 2 hours. And I just feel like when I'm doing that, I'm just floating in the air.
And is this every day, or is it just like every week? What's your?
I start out my morning with yoga and meditation, but on the weekend, I do a little longer.
Yeah. Okay. What's one lesson your patients have taught you that you never learned from textbook, let's say, but your patients taught you that lesson? What would that be?
Have a good bedside manner. Be a listener. Just listen to them. All they want, somebody who pay attention to what they're saying. Just listen to them. You
Fantastic.
cannot know everything. You cannot know everything. And I have seen, even if you know everything, but you were not a good listener, you will miss out so many things that they came in to tell you. So just listen to them.
Yep. Great answer. What gives you hope about the future of healthcare?
I think the future of healthcare is excellent. Excellent. Especially now we have AI coming. I have heard both sides of the stories that it's not going to be good, but my heart says that with the help of AI, we will be able to perform better. For example, when I'm doing charts in the clinic, it would take me some time to finish it. But with the help of AI, I'm able to have eye to eye contact with my patient I'm able to listen to them while my AI types up exactly line by line what the patient is saying and what I'm saying and puts it in a nice context very briefly so I don't have to write big paragraphs and everything is in that. So I put that in, I review it. There's a transcription in case we missed out something. My notes are done in 30 minutes, and I have quality time at home with my family, and I don't have to worry about doing things. That is just my experience, but I'm thinking the industry is revolving and evolving. There's good things on the horizon. I'm very excited.
Great to hear that. This is probably the most common application that I'm hearing from a lot of providers, that this is really already taking shape in their workflows and helping them
Very
already
much.
already helping them with the time they need to, gaining back the time and not wasting on those things. But also the care is improving because now you can really get all the relevant information on your fingertips. Not that it wasn't available earlier, but it was like time wasted in getting to that point. But now it's extracting for you, almost like a super note in the EHR to show you what it is. Wow. All right.
Most of the providers have this issue that my charts are still open. That's what I will be doing on the weekend. So, what are you doing tomorrow evening? Finishing my charts. We don't have to do that anymore. Patients love it that they had undivided attention and you were just looking eye into eye, shaking hand, nice thorough exam. You don't have to do anything to type up because AI captures everything.
Yeah.
That is in the clinic setting. I'm pretty sure there are going to be some AI assisted surgeries or machinery work, which I'm not aware of. I also heard recently, I was interviewed using AI to do the orientation for healthcare providers when they get newly hired.
Hmm.
Would this be helpful or not? And I said, we need to try. So far, it's working good. Why not we try? So my thoughts were supportive. And I said, we should go forward with that. So,
Yeah. Fantastic. Wow. By the way, um, on the same lines, we actually have a show called the AI Ready Doctor, and it is a shout out to one of the doctors who actually he took upon AI a few years ago, and he then went into medicine and research, and now he's made his mission to teach doctors or clinicians the AI, so the workflow. So he works with a lot of companies, exploring what's working and bringing to his podcast. So
wow.
so, Dr. Ben Chakran, if you listen this, shout out to you.
Yeah.
All right, cool. Thank you. This has been great. Really, really appreciate you taking the time. If our listeners wants to connect with you, how can they connect to you? Where can they reach out to you?
They could call 817 or they could email me directly, drmayanp17 I would love to hear from them.
All right. And we'll put in our show notes both the things too. And we will also include the link to your website as well, so people can find you and reach out to you if they have any questions or just connect with you. All right, cool. Thank you so much for your time, Dr. Pada. This has been great. And it was pleasure to learn about your story, how you evolve, what you're doing, and just to get a glimpse of what's behind you, like what is really, keeping you moving in this direction. So thanks for taking the time and appreciate sharing everything.
Thank you.